relevant awareness around diabetes and the various aspects related with it. It also serves as a reminder to policymakers as well as common people to switch towards a preventive lifestyle. The impact of diabetes on the body is extensive and it can affect various organs of the system. So to discuss more about the various problems that can arise in our body owing to diabetes, we have gathered here to discuss on the topic diabetic complications and their impact on your body. For this very important discussion, I am joined by an array of experts. I have with me Dr. B.M. Makkar, who's the President, Research Society for the Study of Diabetes in India. Welcome to the discussion, sir. You are on mute, sir. Yeah.
Good evening, everyone. Good evening, Dr. Jamal, sir.
Good evening.
How are you, sir?
ठीक है आप.
And I'm also joined by Dr. Jamal Ahmed, who's a senior endocrinologist from Aligarh Muslim University. Welcome to the discussion, sir. We look forward to a very, very engaging and informative session with you.
Thank you.
I'm also joined by Dr. Pankaj Maheshwari, who's a chief pulmonologist and intensivist at Indian Railway Health Services.
Good evening. Good evening.
Good evening.
So we'll be, without any further ado, we'll be starting with the discussion since I have a set of luminaries with me and to discuss about the various, factors that are important when we talk about diabetes prevention. So coming to you, Dr. Jamal, when we talk about diabetes, and India the numbers are rising. We have seen that how India is, has become in fact the diabetes capital of the world. So, and largely type 2 diabetes are preventable for that matter. So when we talk about the various risk factors, how would you, please give us an insight on what are the risk factors and how, one can adhere to a preventive lifestyle.
Thanks, Dr. Bajat, and I'm really honored by the presence of so many of my friends here. Dr. Makkar is here, Dr. Pankaj is also here, and thanks really to BI and ISW Council. They are doing the great job because the awareness is very, very poor in this country. I'm sure we all know that diabetes is a chronic disease, it's a progressive disease, it's an inflammatory disease, it's a degenerative disease, where change in lifestyle and some genetic factors make us to suffer more of this kind of disease, at least in India. We all know that luckily now we are not the capital of diabetes. That position has been taken now by the China. So it's a good thing that we are now not the capital of diabetes. And in fact, we know that if you see the publication that appeared in August 2023, number of people who are suffering from the disease has already crossed to 10.1 crore. And there are 14.4% people who are pre-diabetic. The other problem is that I think more than 75% people who are suffering from this disease, they reside in the South Asian countries. Diabetes is important because we know that we have got a series of complications of diabetes. It's one of the manifestations of Caramal disease. We talk about the cardio, renal, adiposity, liver disease, and the food problem. It's one of the manifestations. It's not the cause of Caramal disease. And if you see the problem that is impacting our life, 1/3 of the people at the time of presentation, as far as the type 2 diabetes is concerned, have got some form of atherosclerotic cardiovascular disease. 40 to 50% people, they have got renal disease. Again, around 50 to 60% people, they have got peripheral neuropathy. Depends on how do you assess neuropathy. 25% people, they have got foot problem. Around 50% people, they always develop diabetes related retinal disease in their lifetime. You can see the quantum of complications, the affecting each and every organ in the body that a diabetic poor person has to suffer. This obviously will affect our life and day-to-day activities, and also consume a lot of nationwide money also. As far as concerned is, we all know the common soil hypothesis. If a person is obese, if a person has got a family history of diabetes, is hypertension, you can see around 35% people are also hypertensive. You can say 70-75% people, they have got FMLD, previously called as NASH, and more than 5% people, they have got hepatic steatosis. So the risk factors are known. They talk about diabetes, they talk about coronary artery disease. That is a common soil hypothesis. The person is obese or sedentary lifestyle. There is a change in the food habit. On the background, there are some genetic factors who are playing an important role. So obviously, if you have to, our aim is obviously two aspects when we talk about diabetes treatment. One, how to prevent this disease, because 14.44% people, they have got pre-diabetes, and this is a stage where prevention plays a lot of role. And the other is that if somebody is having to be diagnosed as case of type 1 or type 2 diabetes, how early you are able to achieve glycemic control. Because if you are able to achieve glycemic control at early date and maintain a good glycemic control, you can prevent or postpone diabetic complication in future. And the third aspect is that if somebody has early developed complications, how to deal with and how to make life comfortable of that particular person.
Yes.
Thank you so much.
Yes, Dr. Jamal, that is very important, and I'll come back to you on that. Coming to Dr. Bridge, when we talk about, sir has already said that how prevention should be the focus, and pre-diabetic, agar hum baat kare patients ki, so do you think this increase in number is also because of the fact that we have moved to a more urban lifestyle, and if we can control, वहां पे कुछ if we can do to control those symptoms in their early stages itself, and how important is that early prevention?
Thank you, Dr. Bajat. I think this is a very important part which we should look at. In fact, most of the time, pre-diabetes is not even diagnosed or considered as an issue. But I am going to take you from the points where Dr. Jamal sir has already, discussed. Now, he mentioned that we have a bigger prevalence of pre-diabetes than diabetes. Now, pre-diabetes is a stage which is reversible, which is, people may progress to diabetes, people may not progress to diabetes. But in India, the bigger challenge is the conversion rate from pre-diabetes to diabetes is higher than the white population. So our ethnicity, what we call as Asian Indian ethnicity, we are more prone to get diabetes at lower levels of body fat. And the sir already talked about obesity as a major precursor for diabetes, and now we know obesity possibly is the major driver for the increasing prevalence of diabetes. And we should actually, if you want to, control the epidemic of diabetes, we have to go upstream and start focusing on pre-diabetes and obesity as the starting point, not diabetes as the starting point. And another important thing is once somebody gets pre-diabetes, they are already at increased risk of getting high blood pressure. They are already at increased risk of getting lipid problems. They are already at increased risk of getting cardiovascular disease and increased risk of early death. So it is very important to identify pre-diabetes and obesity as a major challenge to, to stem the growing epidemic of diabetes. Now, how do we do that? I think we have to focus on early detection. So otherwise also, there are a lot of discussion and a lot of papers that show that we will get diabetes almost a decade earlier as compared to the white population. So we should focus on early screening for diabetes. Now, how will we pick up pre-diabetes? If we start screening high-risk people, who are the high-risk people? The people who are overweight or obese, people who have family history of diabetes, people who are having other problems like high blood pressure, like cholesterol problem, people who are physically inactive, who are into more sedentary jobs, people who are having any other kind of precursor, which could be in young girls we see polycystic ovarian disease as one of the major things. So all these things are indication that these people are prone to get diabetes. So we screen for diabetes, we will start picking up pre-diabetes also. And intervening at pre-diabetes level will not only curtail the diabetes, but also cut down the risk of getting all the downstream complications of diabetes or obesity also. So I think it is very important to focus on pre-diabetes. And now, if you look at the treatment strategies earlier for pre-diabetes were that you focus only on lifestyle intervention. Now, most of the guidelines are looking at even the pharmacotherapy. That means you start treating these people using medications, and they are medications approved for treatment of pre-diabetes in high-risk groups. So I think it is very important to focus on or actively look for pre-diabetes in population because these people don't have any symptoms. They don't have any complaints. They can be picked up only on screening. So we have to look for them, identify them, treat them early so that we can cut down the diabetes level.
Right, Dr. Bridge. Very rightly you've pointed out. Coming to you, Dr. Pankaj, since we talked about the risk factors, how they can be modifiable, some can be non-modifiable. Dr. Bridge talked about how genetics might play a role in that. Coming to you, when we talk about our basic like air, water, and these are some of the basic things that a human being needs to survive. And talking about a preventive lifestyle, okay, you can ask somebody to take a walk, to have less amount of food. But according to normal, latest research, I mean, in Delhi, the air pollution is so high, and that is also, in a way, you cannot control that, though it is a modifiable risk factor. So please share your insights on how things like air pollution can play an active role in diabetes.
Actually, this is one of the controversial topic. You can say that diabetic with modifiable and non-modifiable risk factor are there, but related to the air pollution. So it plays an indirect role. People are more stick to the sedentary lifestyle because they don't want to. You can say that as Dr. Bresh told, ki you have to need to change your lifestyles by means of food, by means of regular exercise. So obviously, it's hamper your exercise pattern. It hamper your routine practice, whether you can go outside and routine walking, even the brisk walking when some sweat or extreme sweat, so it decreases the calorie. But if you can say that by means of air pollution, particularly in Delhi, where odd even numbers and other things are going on. So
it is for you, yeah. It is a controversy. That's why I asked, because
obviously,
we have a lot of misconceptions and myths associated. I have seen people saying that, "Arey, मैं तो मीठा खाता ही नहीं हूँ, फिर भी मैं diabetic हो गया."
That's why there are various misconceptions there. कि जरूरी नहीं कि आप मीठा खाएं तो ही आपको diabetes हो. Genetically prone, obese, even the lean and thin also getting diabetes. High obese also getting the diabetes. People in a very clean air also having the diabetes, even in the areas prone for air pollution. But it plays indirect role by means of decreasing exercise and decreasing inactivity of the people. People usually going to the office by means of bike, car, taxi, travels. So their work, you can say that exercise is quite low. So it increases
Physical activity is not there.
physical inactivity is there. So it creates chances of insulin resistance are there.
It
The
is.
more sugar deposit, it causes more obesity. In a normal individual, the caloric intake is usually 2100 kilocalorie. That means 30 kg per day in normal individual, sedentary. But if you are inside the home, the carving of food is there, midnight meal is there, people residing in the sofa just lie down and watching the TVs along with the fast food and snacks because they don't want to go out by means of physical activity, cycling and other things. They just eat, they just watch, they just did their job by means of computer and other things. So the extra calorie, the intake by means of coffee, sugar, other things, by workload, excess things, it deposits it in our body. So it ultimately leads to development of insulin resistance and development of diabetes. So if you just decrease your calorie intake by means of 5 to 10 kg per kg of body weight in a healthier individual, so chances of, you can say that sugar level is to be maintained in our body. So this is one of the indirect effect of pollution, you can say, but there is nothing direct link with it.
Right. Dr. Jamal, coming back to you, since you briefly touched upon how, diabetic neuropathy, and so we would like to know more about the impact of sugar on your nervous system and how it, results in a negative, and what are the early signs and symptoms, when we talk about, increased sugar levels having an impact on your nervous system?
See, the effect of hyperglycemia on the nervous system, it can be divided in many ways. But you could have the acute symptoms which are directly related to hyperglycemia, and then you have got chronic symptoms. These are basically the degenerative complications of neuropathy. In acute hyperglycemia, the person most of the time you see in the day-to-day clinic, at least 50 to 60% will come, they are feeling numbness. They are feeling tingling and numbness sensation in the extremities. And कभी कभी उनका डिस्क्रिप्शन होता है कि डॉक्टर साहब वो पैरों में चींटियां काटती हैं. It's a very common complaint. They also say that they have got burning feet, and so much so that they say when they get up for the sleep, they have to keep their leg out, and the moment they cover with the cloth, it gets irritated and they are not very happy. So this is the common sensory symptom presentation in acute needle sensation along with the burning sensation. The other effect of acute hyperglycemia is on the brain. The cognitive functions deteriorate. The person say that they are not able to concentrate. They don't feel like working. They don't feel like going to anywhere. That's a negative impact, and basically their cognitive function is disturbed. Now, when the person is a diabetic for many years, then you get the degenerative changes in the nerves. We call it as Schwann cells, or the sheath that covers the nerves. So there are the degenerative complications. Now, they could be symptomatic and they could not be symptomatic. There will not be any symptom. Now, there are many patients, particularly when the duration of diabetes becomes more than 5 or 6 years, they are not able to feel any sensation. They say that somebody has hurt their feet, or when they change the shoes and other things, and even if they get injury, they don't have any feeling. I have seen many patients, particularly who used to sleep in the village, in the paddy, when the paddy used to be there. So they used to say, "Doctor Sahab, मैं तो रात में सोया था, सुबह देखा तो उंगली गायब हुई, चूहे काट के ले गए." So that is a degenerative complication, painless neuropathy, where the person is not aware what is happening. The other things is painful neuropathy, pain in the calf muscle, and they say the classical description of these patients, डॉक्टर साहब ऐसा लगता है जैसे कोई करंट लग जाता है, नीचे पैर से लेकर ऊपर तक करंट चल जाता है. Many people, they are confused with the sciatica because it's very easy to say sciatica when you don't know what to do. So other complaints are, but basically, and when the diabetes becomes chronic, they can feel that they have got pain in the back, they have got pain in the back radiates to both lower limbs. Lower limbs are affected because the larger fibers are affected first as compared to upper limb. So they can say that they have got the electric-like sensation in the limbs, they have got pain in the back, they have got burning feet syndrome. These are the painful neuropathy. And still there are quite number of persons who will say that they can't feel any sensation. That is what you call as painless neuropathy. Then you have got autonomic manifestation of diabetes complication, and that is a very not very good symptoms or very good sign, because autonomic neuropathy, we all know that occurs in about 20% of diabetic, particularly when the duration of diabetes becomes few years. And that autonomic nervous system can involve intra-GIT system. They can present just like gastroparesis, just like acid peptic disease. They can present as cholecystopathy. It can present as cholecystitis. You can confuse the cholecystitis. We do ultrasound and found that acre plus gallbladder enlargement. Then it can also involve the intestine, both small and large intestine. They frequently complain of constipation. They also complain of diarrhea in between, that is what you call as autonomic diarrhea. Then there are bladder symptoms also, a tonic bladder, or they are not able to hold the control on the urine. And that is also very common complaint. And it's quite common. It's not unusual. And particularly when the age becomes more than 50 or 60 years, and if somebody has got diabetes for more than 6, 7 years, they will say, Dr. Sahab, when I go to, I cannot hold the urine. मेरे कपड़े गंदे हो जाते हैं. So this is the what you call as neuropathic bladder. That is also a complication which is quite common in chronic diabetic people. As far the central nervous system is concerned, well, I have already told you that one can have the cognitive function impairment. But sometimes, though we don't have any entity like central nervous neuropathy in diabetes, but sometimes you can confuse with the acute stroke-like presentation. They might say that for a moment they have got some ischemic problem or they have got some weakness of the limb. You do MRI, you don't find anything. So that could also be one of the manifestation of neuropathy as far the diabetes is concerned. Thank you so much.
Thank you, Dr. Jamal. That was a very clear description of how it can affect the nervous system. Coming to Dr. Bridge, because we have...
Sorry, Dr. Beda, sorry, one thing I just forgot. I'm very sorry. The another autonomic presentation, which is very important, I've just forgotten it. I apologize for that. And that is the cardiac autonomic neuropathy.
Cardiac, yeah. That is, yeah, I'll
and you can get the painless myocardial infarction as much as 40% of people. And the other is that the hypoglycemia unawareness, that is again a problem. If the person is chronic and the symptoms, but if a diabetic has got autonomic neuropathy, then they will not able to appreciate, and they have got frequent hypoglycemia with no symptoms. You can have partial hypertension also. The lying down, standing blood pressure is quite different. They can also have anhydrosis. That is also a very common presentation. There is a typical also neuropathic presentation in diabetes that is called hyperhidrosis. And what they will say that above the umbilicus they have got profuse sweating, and below the umbilicus there is no sweating.
So on
So
those
these are all neuropathic
I'll come back to you,
yeah.
Dr. Jamal, on those symptoms. Talking about retinopathy, Dr. Bridge, because people always, I've heard people saying that eyes are, is one of the major organ that is, affected. So please insight our viewers on that aspect of diabetes.
So, there are two major sets of how does these complications happen? One has to understand. So first thing is that when you have diabetes, you have high glucose levels. You have more glucose in circulation than that is required for a normal person. Once this glucose level goes up and the different tissues get exposed to the higher glucose levels in blood, they start getting damaged. Now, wherever the blood is going in body, it is causing damage because of high glucose levels. Right? So every single organ gets damaged. Now, broadly, these complications or target organ damages are classified into two categories: microvascular complications and macrovascular complications. Organs where the very minor vessels are there, the thin vessels are there, and they get damaged, and organs where the vessels are very thick and the vessels are very small, they get damaged. These are examples of microvascular disease. These get thin vasculature where if there is occlusion happening, it leads to blockage and decrease in blood supply. In any case, in diabetes, there is inflammation. So there are inflammatory, cytokines circulating in circulation. There is increased glucose in blood. There is increased production of free radicals, which cause damage. And then there is decreased oxygen carrying capacity also in the blood. So multiple things are contributing. Retinopathy is one of the examples of microvascular damage, and it starts early in the course of disease. Now, if we look at the cutoffs for diabetes, at the time of diagnosis, almost 12%, first diagnosis, almost 12% already have retinopathy. In fact, some of the studies have reported up to 25%. Some of the complication will already be there. Now, once we look at the eye complication, it is not just retinopathy. The more common or more important complication is early cataract formation in people with diabetes. They get early cataract, and this is one of the commonest cause of blurred vision or blindness in people with diabetes. But this is treatable. Retinopathy, if you don't diagnose it early, it can come to a stage where you can lose vision totally, permanently also. So it is very important to screen for retinopathy, nephropathy, neuropathy, and all other complications for diabetes, right from the word go in people who have type 2 diabetes. You have to also understand that what we are discussing here largely is applicable to type 2 diabetes. Type 1 diabetes is a different disease altogether. It is early onset, usually happens in children, has autoimmune, etiology, and only treatment is insulin.
Insulin, right.
Type 2 is different, where we have insulin resistance, and on the background of insulin resistance develops the insulin deficiency, which is not absolute. And insulin resistance largely is contributing to development of macrovascular complications of comorbidities, and the insulin deficiency and hyperglycemia that is occurring is contributing more to the development of microvascular complications. I am giving you a very simplified kind of version. So people who have type 2 diabetes, right from day one, they should be screened for presence of microvascular and macrovascular complications, because you have to understand that insulin resistance is one of the core defects in type 2 diabetes. And insulin resistance is the defect or pathophysiological abnormality that drives the development of abnormal cholesterol, development of blood pressure, development of plaques in the arteries, and development of heart disease, coronary artery disease. At the same time, it also drives the development of increased blood glucose levels, which leads to more of microvascular complications, which are related to duration of disease. So, right from the word go, you have to start screening for all complications, detect retinopathy early, and get it treated. Otherwise, it is very important, complication which can lead to blindness, which can be very crippling.
Right, Dr. Makkar, you have emphasized on the importance of early detection. And
Absolutely.
if we talk about the current scenario, I mean, how technology has evolved over the last decade, we can, simply with a smartwatch and, devices like that, though 15 years back, it was a process that was done in labs. And now early detection has become, just a click away. So you think this kind of change is going to somewhere down the line bring some good news?
Absolutely. So there are so many technologies which are under development. There are AI-based, gadgets now. In fact, earlier the detection of retinopathy was not possible without the intervention of an ophthalmologist who will examine the fundus physically and look at what are the changes in vessels. Now we have so many fundus cameras which, based on the artificial intelligence, which is cloud, they are linked to the, you just take the picture, which can be fundus picture, which can be done by a technician. This picture gets uploaded to a cloud-based analytic system, which is based on the artificial intelligence, can give you pretty accurate description that this fundus is normal or not normal, and this comes in 2 minutes time. So you don't need to, decide whether person has retinopathy or no. Uh, don't need a ophthalmologist for that. Once you know there is retinopathy, of course, you will refer this patient to a eye specialist or ophthalmologist for treatment. Now, with the advantage of this, now people sitting in the remote areas, people in the rural belts where there is hardly any primary care facility also, screening can be done using these kind of gadgets, right? And these gadgets don't need, actually the amount of expertise needed for these gadgets, operating these gadgets is also coming down. Google is also working on a system which can easily, help you deciding whether there is retinopathy or no. Now there apps are being worked at where you look at the screen on the phone, and the phone will take picture of your eye, and based on that, phone can, based on that app and AI based analytics can tell you with reasonable amount of certainty that this person has retinopathy. And this can be done sitting at home also. So I am sure the technology is going to be big help for people, for the practitioners, healthcare practitioners, to diagnose the problems early and to manage these problems early. So technology is going to be a big boost for everyone.
Right, Dr. Makka, very rightly you have pointed out the role of technology which can be proactively used. Coming to you, Dr. Pankaj, when we talk about technology and these, innovative interventions, do you think they are accessible to a larger part of the population? What is your take on that?
No, ma'am. Actually, as you say that most of the technology are basically either by the high end of a smartphone or either by means of AI intervention. You can say that. Suppose you remember the Corona time. At that time was there many pulse oximeter are market in there. There are various pulse oximeter. Kiska saturation 70 आता था, but patient is totally healthy. So they misinterpreted. And if you say that कि जैसा कि डॉक्टर ब्रजन सर ने कहा कि गूगल है आल्सो डेवलप ए आई बेस्ड डिवाइस दैट यू कैन गो सो this is a technology first they usually you can say suppose a simple example if a drug is developed in the market so its initiation of development of thought process starts nearly 30 years ago then it comes into the market after phase 1 trial phase 2 trial phase 3 and phase 4 then post-marketing circuit surveillance is there like tenligliptin is came to the market then again after 10 year or after 6 to 7 year the complication is pemphigus is there so the black box warning is there so post market surveillance is there same like in these devices the device came into the market you can say that oxygen saturation by means of a smartwatch it beat counting and other thing but it cannot measure the blood glucose and other things and the people is quite unaware in cities where the people don't have time for their own health because they develop such lifestyle like sedentary so they are more prone to development of diabetes so the artificial based AI based intelligence just help a little but not exactly people mostly in my clinical practice I usually saw the patient presented with the complications patient is having diabetic foot we is totally unaware that as Dr. Jamal sir told कि गांव में सोया है रात में अंगूठा काट के कोई ले गया then people realize कि उसको diabetes है or the patient is having diabetic retinopathy nephropathy or neuropathy माइक्रोवास्कुलर कॉम्प्लिकेशन अचानक दिखना बंद हो गया यूरिन में कुछ फोमिनेशन आया
That is why,
अचानक स्टोकिंग ग्लव्स या इंटरमिटेंट क्लॉडिकेशन या अदर थिंग हुए सो द परसेंटेज ऑफ AI-based technology in help of diabetes, because patient have to know there is something wrong
Yes.
in his body. It is
That
hard
is
to
why
accept that they have something wrong in his body.
wrong in
That
that is
doctor
why
that had to
awareness
decide, no, you have something wrong in your body.
Yes, and that is why awareness is important. Though
Obviously.
I would agree that after Corona
So
we have become more health conscious. Yes, Dr. Makkar.
can I speak?
Yes.
So let me, give a different perspective. I think, that we are working in different fields. Diabetes is one field where the pace of change of technologies is tremendous. Now, Dr. Pankaj gave example of, diabetic foot and other things. Now, gone are the days when, we were looking at these foot complications very much in cities. But even Dr. Jamal will tell you that in cities now, we are able to diagnose these things much earlier, much earlier. Yes, there are issues. There are, areas where these facilities are not available, the education is not available. That's fine. But we have a huge population. Even if you reach a small percentage, it means huge number. It helps in cutting down the healthcare burden. Now, for foot, you will not believe there are technologies which are able to identify a foot at risk before the diabetic foot develops. We are already in the process of developing socks which have sensors inside the socks, and they communicate with the gadget in your phone that your foot is having high temperature in particular area. So just examine this area; it may be getting inflamed, right? There are foot sensors in the shoes which can communicate with the phones. There are apps being developed which, looking at your face, can tell you that your BP is all right, your pulse is all right, your stress level is fine, your oxygen saturation is fine. No sensors. It is the facial color and temperature sensing on a phone app. We were talking of continuous glucose monitoring. Now they are looking at virtual glucose monitoring. Based on the past record of the people, this has been his glucose pattern over last 2 months. The app can predict that what is going to be his next glucose in next 1 week or next 2 weeks. And you can intervene beforehand. So technology is something which is beyond our imagination. Technology is something which is driven by imagination. If you can imagine something, you can convert this into a technology. It is, as simple as that. It may sound very weird, but nobody had thought 30 years back that every rickshaw puller or every, vegetable vendor will be having a smartphone and having a Paytm put in his counter where he will be taking 10 rupees payment on a digital mode.
Right.
Could you ever imagine that?
I'm just enjoying the diverse viewpoint.
So just,
Actually,
technology is
percentage of the
something.
people. Sir, please continue.
No. Just look at the way technology is infiltrating everybody's life. And smartphone is not that expensive now. You can buy a smartphone for 5,000 rupees onwards.
Right. Right.
You don't need very high-end phones. So people are actually, even the illiterate people are using technology. Something very simple, I tell you. Technology is not that you have to have high-end gadgets. Something simple as glucose meter could tell you, this is the glucose value. Now, a illiterate person cannot read what is the number.
Right.
One major change that happened on glucose meters, they mark 3 colors: green, red, blue.
Right.
Okay. So if the arrow is on green, that means your sugar is normal. If it is blue, that means sugar is high. If it is red, your sugar is low and you have to act urgently.
So
Person does not need to read or be literate. Just look at the color where the arrow is and decide your sugar is okay or no.
Right.
So there are so many things which are coming up, and technology is there. We cannot avoid technology. We should look at, how we can adopt technology to improve our delivery of healthcare and how we can make patients' life better.
Obviously, sir. My point is also same. We technology is obviously help, to diagnose and early
Awareness.
detection of disease, but it
Yes.
is not the whole and soul, because the cumulative
it is
population that are
definitely-
No,
using the
no, no.
technology.
I'm not saying technology will take over the, physicians. It is to assist physicians. It is
Yeah.
to
Obviously, sir.
take over the overload from physicians.
But the percentage, as you told us, sir, ki autonomic socks are there, but the percentage that are using early
No,
detection
I'm so not saying
quite
it is
less.
when the first, cell phone came into market, what was the price of cell phone?
Right. In the coming years, we will see the
It
proliferation.
was 30,000
Obviously, sir.
rupees and 16 rupees per minute was the call.
Obviously, sir. Over the time, it accessible to
So
everyone.
every technology to begin with will be expensive, but if it is scalable, it will become dirt cheap.
Exactly. Very rightly pointed out, Dr. Makkar. And I'm sure Dr. Pankaj is also
Obviously,
enjoying
ma'am.
the conversation
Hopefully, soon it
as
available,
much
but
as I am.
at present, I can't see the future properly.
It will happen. Coming
Obviously,
to
but
Dr.
it will
Jamal.
take time.
Yes, of course. Coming to Dr. Jamal, sir, when we talk about the Indian scenario, and like it was, discussed in the beginning, that as a race, we are more prone to diabetes. But do you think culturally also we Indians are, like we say, kuch khushi ki baatein chalo meetha ho jaye, and the way our eating habits are, so, do you feel that culturally also we are, in that phase, and how can counseling play an important role when we talk about diabetes management? Because along with your medication, you have to have that complete overhaul of your lifestyle.
The classical description for a diabetic person that is given as thin fat Indians. We have got lean body mass, we have got ectopic fat deposition, abdominal obesity, and as Makkar said, the insulin resistance. Then on that, we have got genetic background, because it's already established with the help of autopsy studies that Indians who are born, they have got less number of beta cells as compared to Caucasian population. The size of beta cell is also small in Indian population. So that's the genetic background, why the prevalence is much more, to my mind, very. But our habit is really one thing which you cannot imagine. 70% of our time is involved in taking carbohydrate meal. And the greatest culprit, which I always say, is gluten. We consume a lot of gluten. And when I started my practice after leaving the institute about 7-8 years back, when I used to ask the people, you tell me what breakfast you take. So, Doctor Sahab, bread lete hain, roti lete hain subah. Now it becomes very difficult to convince them that you take roti, but you modify it. इसमें थोड़ा सा आप कुछ और आइटम मिला लिए, जौ का आटा मिला लिए, थोड़ा सा चने के बेसन मिला दिए, बाजरा मिला लीजिए, ज्वार मिला दीजिए. डॉक्टर साहब वो तो सभी तो यही खाते हैं, आप बताते नहीं. Now I had a tough time. Then I said, look here, okay, you don't believe me? What you do that in my practice, more than 90% people, they have got glucometer. That I always ask them, you have to have glucometer, regular monitoring, and show me. Otherwise, I will not see you. Those who are poor, I am providing glucometer free to them. So they said, I said, look here, now I don't have any excuse. If you don't have money, I am giving glucometer. And thanks to the farmer people who are helping me also. So, sir, okay, go back and take roti and do blood sugar after 1 hour. Take paratha, do blood sugar after 1 hour. Take puri and kachori and do blood sugar after 1 hour. And then one day you take the less amount of gluten, more amount of bajra, jowar, jaw, and don't tell me. And you come after 15 days, forget what is level of blood sugar, and tell me what you found. Then they took surprise. That's why हमको पता नहीं था कि इतनी बुरी चीज होती. When I take गेहूं roti, my sugar goes to more than 300. And when I shift to jowar, bajra, and other millet items, it is coming down to 150 and 60. So it's really counseling is very important, and what I usually say that it's not a very difficult thing. I simply say that, look here, you cut down the amount of गेहूं का आटा जो आप रोटी खा रहा, रोटी खाओ, मना नहीं करें, बगैर रोटी खाए कि जिंदा नहीं रहोगे, लेकिन रोटी की क्वांटिटी फिक्स कर दो. If you have to take 2 roti, you have to take 2 roti. If you are not, you say that हम भूखा रह जाते हैं, add plenty of salad. It's easily available, तो फाइबर सप्लीमेंट हो जाएगा उसमें, आपको पेट भर जाएगा. But roti quantity fixed, because one roti makes a difference of about 70 milligram of sugar in day-to-day practice. So this counseling is very important. This obviously the physician, it's very difficult for the patient to do that. You have to have then a diabetic educator. I have got a diabetic educator. Unfortunately, most of the government institutions, they don't have any so-called diabetic educator, despite having so much budget. So if you have got two things has to be there as far as the counseling concerned. One is a little bit about diet counseling is important, that these items are bad and these items are good. And if you do repeated counting, the patient understands. And if they ask them that, look here, do the blood sugar, and then come to us that whether we are wrong or we are right, then they feedback. The second is that if you have got a diabetic educator, he will ask you just what medicine I have prescribed, whether the person is really taking or not. There are many people, if I write 10 medicine, they will say, Dr. Saab ne zyada likh diya hoga, 4 khao, 4 ko chhod do. So this counseling is very important. Unless until you do counseling, you do the counseling for the food, counseling for a little bit exercise. We all know that 30 minutes per day exercise is very important. But if somebody is able to walk 15, 20 minutes, encourage him that, look here, you make a small beginning, do something. Whatever time you have got, do exercise, 5, 10 minutes. And the moment they got this type of encouragement, they automatically increase. So that is also counseling, which is very important. Spacing of diet is also very important. We always do in the counseling, look here, don't take big meals, take small meals. You can take meal multiple times in a smaller amount. I used to give one example. I said that, look here, 5,000, 6,000 back, the doctor clearly said that, look here, when you eat food as a medicine. If you don't do that, then after some time you have to eat medicine as a food. So that time of encouragement can be possible only by counseling. That, look here, I'm not saying that you don't eat it. You take 3, 4 times whenever you got time, but a smaller amount. Add fruits in your diet, add salads in your diet, cut down the number of chapatis, and there are certain fleshy vegetables. We just try to discourage it. And for the Indian people, the fleshy vegetables are baigan, kashifal, katal, arvi. These are the fleshy vegetables where the blood sugar jumps like anything. A very common practice. वो डॉक्टर साहब कहते हैं करेला खा के डायबिटीज कम हो जाती है, खत्म हो जाती है. I said I am not against करेला, लेकिन तुम हमको एक बात बता दो, ऐसा कौन सा करेला है जिसमें आपको ढेर सारा तेल न डालना पड़े? वो करेला पकता नहीं बगैर तेल के, और जब तेल डालोगे तो तुम्हारी ब्लड शुगर ऊपर बढ़ जाएगी. So whatever counseling you are doing, whether you are doing counseling for the quality of the food, whether you are doing counseling that this thing is good or this thing is bad, emphasis should be there and each time it should be repeated. But always please ask the person to take salad. It's very important. आप यहाँ बताना शुरू करते हैं, डॉक्टर साहब सलाद खाते तो हमको नजला हो जाता है रात में. हमें so many things are there. So जब उनको कभी आप खा के बताओ अगर तकलीफ तो मेरे पास सुबह आ जाना, हम देखते नजला कैसा हुआ. तो एक है, मतलब हम लोगों की जो एक टेंडेंसी है, आप किसी शहर के किसी मोहल्ले में चले जाओ, हर जगह आपको समोसा, पूरी, कचौड़ी मिल रही, सभी खा रहे हैं. I'm not saying that they're eating deliberately. These poor people, they don't know whether this is good or bad. So really, if you do counseling, that will play very important, that will try to solve our glycemic control also. This will also reduce the glycemic variability. That is what fluctuation is. We all know the glycemic variability is a bad thing for showing the cardiovascular complication, other things. So if you do these counseling, I think this will help, and not only will help us in controlling diabetes, this will also pose an important aspect as far as the confidence of the person is also concerned. But you have to really give an example that I am saying you have glucometer, do it, and then tell us whether
Exactly.
I told you correct advice or not. Thank you.
Right, Dr. Jamal, very rightly. And if we would have known it would be such an interesting session, we would have, uh, planned it for 2 hours almost. Coming to you, Dr. Makkar, since we are really running short of time, and we were, the topic was basically on how, various complications that diabetes can have on their body. So when we talk about those complications, and I was hoping to touch upon issues, though we have covered many aspects, but of course fertility and of course chronic kidney way, how it affects. So if you could just touch upon them very briefly with a focus on how changes in your lifestyle can go a long way in avoiding these complications, that would be very helpful.
So, see, I mentioned about the basic concept of how the complications develop. Now, first, to understand, how lifestyle changes work, you have to understand how diabetes is caused. Now, type 2 diabetes is caused by two major components. One is the lifestyle factors, and other is the genetic predisposition. There are epigenetic factors also, which can be part of environment, which modify the genetic expression. But there is a strong genetic predisposition, and there is ethnic background. So by virtue of our ethnicity, that is, we are Asian Indians, we have high risk of developing diabetes. Just because we are Asian Indians, 20% risk of diabetes. One parent has diabetes, 50% risk of diabetes. Both parents are diabetes, 90% getting risk of diabetes. Because of our bad, not bad, the ethnicity and high risk, we develop diabetes earlier than the other communities or other populations. As sir mentioned, we are thin fat Indians. For the any given body mass index or any level of body weight, our body fat is twice as high as compared to a Western person. So for the same height and weight, we have almost 2 times higher fat. And the worst thing is this fat is there in the wrong places, which predisposes to increased risk of diabetes and complications. Now, when we come to treatment of diabetes, you have to understand that we cannot do anything about our ethnicity. Can we change it? No, we are already there. We can't change our parentage. We can't change our family history. So these are non-modifiable factors. What we can change is the lifestyle factors, the environmental factors that we are exposed to. So that is where there is a big focus on lifestyle intervention. Second thing is when you are treating diabetes, you have to create it's a disease of body metabolism. You are having increased intake of food, you have higher sugar. You cut down the food intake, it goes lower sugar. You are not exercising, you need less calories, your sugar goes up by X amount of food. You start exercising with the same amount of food, your sugar will be lower. Now you are using medication. This suppose we use X amount of medication will bring down the sugar level by 50, right? Now this sugar level needs to be brought down by 50 when person is having Y amount of calories on daily basis and doing Z amount of exercise on daily basis. If you consumes Y plus 20 calories, this drug is not sufficient. If person is making less exercise, this drug is not sufficient. If person is consuming less calories or doing extra exercise, even this drug becomes more than required. So the sugar level goes either high or less. So you have to create a balance between lifestyle, eating, and medication. At the same time, you have to keep monitoring because most people think that they will get fasting and postprandial blood sugar from lab and they can decide the sugar is normal or not. Sugar fluctuates minute to minute in body. So you have to keep monitoring your glucose levels on regular basis to keep a track of your glucose control. So if you want to control diabetes well, you have to create a sync between diet, exercise, medication, and monitor regularly. then only you can manage diabetes well and cut down the risk of complications. Now, if we focus on enumerating complications, there are many, but major complications are kidney, retina, and nerves, microvascular side. Macrovascular side, the increased risk of heart disease, heart attacks, strokes, and heart failure. And of course, kidney disease partly is on that side also. Then is the complications like diabetic foot, which are due to combination of neuropathy and peripheral arterial disease. They can be variable combinations. Then there are other areas which can be there. We look at the mental health. Mental health is a big, problem with diabetes. People with depression are increased risk of diabetes. People with diabetes have increased risk of depression. People who are on antipsychotic drugs have increased risk of diabetes. There are very many intricate connections. So it is very difficult to define what exactly is connected to what. But majorly, if you are controlling diabetes well, then you are reducing the risk of complications. Most important thing is once you look at the management of diabetes, it does not mean only controlling glucose. You have to control the other comorbidities also to cut down the risk of complications. So you have to control glucose. You have to make sure your cholesterol levels are on target. They are lower than the average normal individual. Your blood pressure is on target. You are having regular physical activity. You are following a healthy diet. You are having regular screening for various complications, and you are on certain drugs like statins to prevent the heart disease or other complications. You should be having a normal renal function. You should have regular screening for presence of fat in the liver or the presence of fatty liver disease, because all these are increasing risk of your complications. So it is not just controlling glucose levels. You have to look at all these things and manage all these parallelly to have a holistic management of diabetes and cut down the risk of complications.
Very rightly, you have pointed out about the importance of a holistic management for better quality of life. So we are already spilling out of the time. So Dr. Jamal, I would just request you for a small takeaway, final message for our audience, and if you could just give us a small message for our audience to proactively manage their lifestyle and diabetes, of course.
I think what just quickly in 1 minute I will say that you must have early detection. In India, if somebody has got family history of diabetes and obesity, the screening should start at the age of 25 years. Simple blood sugar exams will tell whether you are diabetic or not. Does not matter whether you are symptomatic or not. Type 2 diabetes, 50% people don't have any symptom of diabetes, only 50% are symptomatic. So only early detection is important for entire population, and particularly if somebody have got sedentary lifestyle, family history of diabetes, screening should start with a simple glucose examination. That is one. Second is early achievement of glycemic control. If you are able to control diabetes within 1 year of diagnosis by lifestyle modification and the combination of the drugs, you can postpone 25% of micro as well as macrovascular complication. If you do same thing after 1 year, you are already at increased risk of 25 to 30% increased risk of developing cardiovascular and microvascular complication. The third is the very concept that Dr. Mary diabetes control को दवा खाना है नहीं. We have to tell that it's a chronic disease. Once you are diabetic, you are always diabetic. You have to take regular medicine. Since it is a progressive disease, your drug will never be fixed. You keep on glucose monitoring and report to your physician who can adjust your medication. So early diagnosis, early achievement of glycemic control itself can postpone 50% of all micro and macrovascular complications. As Makka already mentioned, that you have to talk about glycemic control and non-glycemic control also. Of course, the lifestyle modification, there is no replacement. You keep on encouraging it as each and every visit. The person should be requested to please modify your lifestyle. Look how much calories, what type of food you are taking, whether exercising or not, it should be done. And the screening is very important. Screening for the kidney complication, because 40 to 50% people, they have got kidney disease in type 2 diabetes. Same figure is almost also for type 1 diabetes. For type 2 diabetes, even at the time of diagnosis, you have to get urine examination for albumin, hardly takes 2-3 minutes. You have to do serum creatinine and you calculate what is the eGFR. And then the blood pressure control is very important, cholesterol control is very important. And the other thing which is very important, because I mentioned that 1/3 of people, they have got cardiovascular complication. Even if a person tells you that he has got short of breath, please get his echo done, because that particular person might be having cardiovascular manifestation in the form of simple shortness of breath. There is no pain. It is because of diastolic dysfunction, diastolic heart failure, or systolic heart failure, which is there in more than 40% of the people. I always appreciate technology, but as for the foot complication are concerned, my request to the doctor is that please, once in 3 months, look on the foot of the person also. We normally sit in the clinic, look on the face, take the blood pressure, and we forget to ask the person to take out the socks and see what foot he has got. And a bit of advice that look here, these are the foot problems which is preventable, and the foot complications are preventable. So at least we as a physician should look the feet of each and every person at least once in 3 months. That's very important. And the cardiac screening is important, and simple ECG. And as I mentioned, if somebody says short of breath, you must do his echocardiography to detect heart failure or the presence of the diastolic systolic heart failure or the coronary artery. They are very commonly diagnosed. The retinal examination for type 2 diabetes at the time of diagnosis and every 6 months. For type 1 diabetes, 5 years after the diagnosis. Fund is important. Some people, they who have access to the cameras, you can have the color photograph of the retina. And even if you are asymptomatic, at least you should visit once in 6 months to ophthalmologist to see that whether any eye complication the person is having or not. So nervous system, I already mentioned, is simple foot examination, and just hardly take monofilament, very simple, hardly takes 30 seconds to see whether the person has got neuropathy or not. Can make a quick diagnosis. Depression is quite common. The moment the person say that he is a diabetic, he get depressed. So counseling is also important. And if the person is able to achieve early glycemic control and doing fine and good glycemic control, then you can also reduce probably the incidence of Alzheimer's disease also, which is becoming very common nowadays. It's more common in diabetic person of 60 years. So alertness is important. Education is very important. But there is hardly any education as far as the patient is concerned. उनको कुछ पता नहीं क्या होना चाहिए. So whenever they visit to us, I think अगर 1-2 मिनट हम एक बार बता दिया करें कुछ न कुछ किसी बारे में, तो that might would be helpful. So if you have early detection, early glycemic control, looking for the complication, screening and managing, I can assure you that if this education is there, and thank you all of you for taking interest in the awareness program, then this country will become the best capital as far the treatment is concerned, as far the India is concerned.
Thank you,
Dr.
so
Jamal.
Coming to you, Dr. Makkar, your takeaway message for our audience for today.
I think I agree with Dr. Jamal, and the most important thing is education, education, education. People should be aware about diabetes. They should understand diabetes as a disease, and they should also focus on learning self-care, because every time they cannot go to doctor. And any amount of education is not sufficient. So it should be ongoing, increasing education about diabetes at the level of patients and their healthcare providers. Thank you.
very aptly you have summarized the whole discussion, Dr. Makkar. So thank you for being with us. Dr. Jamal, thank you for being with us. Dr. Pankaj had some urgent issues, so he had to leave in between. But it was a very, very engaging discussion, and I'm sure our audience did take away a lot of relevant information, and which they will apply in their life and help in, and will be able to better manage their diabetes. Thanks for being with us. Thanks for taking out time.
Thank you, and good night.
Thank you.
Thank you, sir. Good night, sir.
Okay,
Thank you, Dr. Brish. Thank you, Dr. Jamal. So that is all for today, and I hope all of you enjoyed the session, and we'll see you again tomorrow at the same time. Till then, please keep following our social media pages for more updated information on health and well-being. Thank you, everyone.